My name is Lauren Brown, and today I'm going to be discussing Stevens-Johnson syndrome. When I was in nursing school, one of the first patients that I was told had an allergic reaction. When I went into the patient's room, I was expecting something simple, rash, hives. However, the patient's skin was literally peeling off of his body with blisters everywhere. Being a nursing student, this intrigued me, and I wanted to know what had caused this to happen. So I went to my nursing instructor and I asked her, what does this patient have? What causes this patient to have this? And she told me it was something that was called Stevens-Johnson syndrome. Stevens-Johnson syndrome is a deadly skin disease that is caused by allergic reactions to medications and some kind of infections. It usually affects the mucous membranes and the skin, and you can find this out at mayoclinic.com. It was first discovered in 1922 by A.M. Stevens and S.C. Johnson. According to Medifact.com, some of the most common antibiotics that can cause Stevens-Johnson syndrome are sulfa, penicillins, ibuprofen, Viaxin, Celebrex, and even some anticonvulsants. The good thing is that there are treatments for this. It usually starts out in an ICU or a burn unit. The first thing that the doctor is going to do is to discontinue any of the medications that they think are causing this allergic reaction. The second thing that they're going to be doing is fluid replacement. The patient will have to have IVs to make sure that we can replenish their body of any nutrients or minerals that they might have lost. The third thing that will have to happen is debridement of the skin. Because their skin is pulling off, we have to make sure that it's in a warm, sterile environment that we can pull off any of the extra pieces of skin that might be causing more of an infection. The fourth thing is going to be a topical antiseptic applied to the skin to try and prevent any forms of infection, and along with skin grafts for any of the skin that might have fallen off and gone too deep. Some of the symptoms that it usually starts out with are flu-like symptoms: cough, fever, headache. This usually then spreads to a rash. The most common places for the rash is going to be on your head, your face, and the trunk area. If this is left untreated, this is where the problem begins, because from there you're going to have blisters that will form that will then slowly expand and start to detach themselves away from the epidermis. Once this happens, if it's left untreated, it can result in death. According to the law firm of Steigerwalt and Associates and sjsupport.org, there are nearly 100,000 deaths per year because of Stevens-Johnson syndrome. This is now the fourth leading cause of death in the United States. Overall, the lack of awareness of Stevens-Johnson syndrome is the main reason that this disease is allowed to spread and cause so much turmoil. There are so many resources that one can use to try and allow themselves to increase their knowledge about this. One of the sites is the Stevens-Johnson Syndrome Foundation. This is a great place where parents or prescribers can go and learn new ways of medications that are now being able to treat it, if there's anything we can do to prevent it. Another place that you can go to is skinassn.org, which is another great way to just get some information on causes and symptoms and things to look out for. Most of the time it does happen in children and also the senior citizens. So just beware when you are working in the medical field to see if you see any of these signs or anything that's going on. I do feel as if we increase our awareness about this, that we can make sure that we can bring this death down, at least 50%. So I urge everybody in here to go and teach yourself, learn, research about it, and understand what Stevens-Johnson syndrome is more, so that we can go out and share the news with family and friends and try to make sure that we can prevent any of this from happening again. again, this is just something that I urge you to do and to continue on. Thank you.